Hey, this is Dr. Zandra Palma. I'm in Venice Beach, California, where the sun flows like wine. But I'm from New York, and in New York we have to worry about things like vitamin D and sunshine and jackets. So let's get right into it. I'm going to tell you what vitamin D is, why you need it, how much of it you need, how to tell how much of it you need, and how to get that much of it. So vitamin D is a fat-soluble vitamin. It's found, we get it mostly from sunlight, but we can also get it from a couple dietary sources like egg yolks from pastured eggs. We can get it from really high nutrient fatty foods like liver, chicken liver, beef liver. It's hard to convince my patients to eat those things, but we can get it from that. From high vitamin cod liver oil, another one that is a tough sell sometimes. But we make most of it in our body from sunlight, which I'm doing right now, and it feels great. And we need it because we use vitamin D to make neurotransmitters, so to make the neurochemicals that allow us to think, make us happy. We use it to make hormones. So sometimes people come in with low testosterone, and I find out that it's just that they had low vitamin D. We give them a little vitamin D, and their testosterone comes right back to normal. We use it to make components of our immune system. So sometimes people have such low vitamin D that they're actually immunosuppressed a little bit. So, they get a lot of colds during the winter. They have difficulty with fighting off viruses and bacteria. And we use vitamin D to traffic calcium in the body. So it has a lot to do with bone health, and it has a lot to do with cardiovascular health. So how much vitamin D do we actually need? The ideal level is about 35 to 60 nanograms per milliliter. So if you go to your doctor and you ask them to measure your vitamin D, they'll measure it in those units, and you want a target of 35 to 60. That there's a couple exceptions, and that's people with autoimmune disease need a level that's a little bit higher. So I recommend 40 to 70. I'll even go up to 80 for some people with autoimmune disease. Some people have mutations, or not exactly mutations. They're called polymorphisms. They're like variations in the gene that codes for the vitamin D receptor. We all have these little variations in our genes. I happen to have one, so I know that I need a higher vitamin D level, so I let myself go up to about 80. And some old school doctors will tell you that they want you at a level of 100 or even higher. That is not good medicine. It's old school medicine, and unfortunately it's based on data that was really financially motivated and kind of baked by scientists that were hired by the supplement industry. So you don't want it to go up to 100. There's a U-shaped curve of cardiac risk. So 50 looks exactly optimal in all the good data. Anything above 60, you're getting into higher cardiac risk. Anything below 35, you're getting into higher cardiac risk again. So how do we get that much vitamin D? The best way is what I'm doing right now. If you can get in the sun 3 times a week for half the time it takes you to turn pink. So for most people that's around 30 minutes, but for, it's different for everybody. That should be enough vitamin D to get you to those optimal levels that I talked about. Measuring is kind of key because, again, you don't want to go too high on vitamin D. So if you can get your vitamin D level, your serum level measured once a season, because the seasons, change how much you're exposed to the sun, that's optimal. So ask your doctor. But if you are going to supplement, I would start pretty conservative if you haven't measured your level, and go with about 2,000 to 5,000 IUs per day. You can go a little higher during the winter. Autoimmune people can go a little higher. And again, those people with variations, like I have a polymorphism in my VTAC gene, those people can go a little bit higher. You can also use a loading dose. If you know that you have low vitamin D, you can start with a high dose, like 10,000 IUs for 2 weeks or a month, and then go back down to a lower maintenance dose, like 2,000 IUs. And then how much should you be dosing vitamin D? Do you need to dose in the morning, at night, during the day? So you can actually dose, because it's a fat-soluble vitamin and it sticks around, you can actually dose the whole week's dose once a week. So don't worry about morning and night, because it's, you can dose it so far apart that that morning-night stuff kind of all evens out. It doesn't matter. You can dose it once a day if it's easier to remember, but you can dose it once a week if that's easier for you. It's a really important vitamin. Another way to get enough of it, if you're not just using a supplement, is just by taking some high vitamin cod liver oil every day. If you're getting a little bit of sun and taking some high vitamin cod liver oil, that should cover you. High vitamin cod liver oil has the added benefit of not just having vitamin D, but it also has some fat-soluble vitamin A. So vitamin A is a fat-soluble vitamin, but we rarely get it in its fat-soluble form in supplements. And, not all of us eat a lot of foods that have that, like egg yolks, again, pastured egg yolks. And all those fat-soluble vitamins are very synergistic. So vitamin D is going to work well with vitamin A. It's going to work better with vitamin K. Particularly K2. So I suggest sometimes if you're going to get a D3, a supplemental vitamin D, you get a blend where it's already mixed with K2, so then it's a little bit more effective. If you have any more questions about vitamin D, you can ask, and Take care.